Hello, my name is Diana Rubio. I currently have the opportunity to work with individuals of all ages. However, the majority of them are within the ranges of 55 to 70 years old. The vast majority of patients I work with are focusing not only on weight loss, but also managing and improving their overall health. Oftentimes, patients are looking for ways to improve their lifestyle with the goal to lose weight and manage their illnesses, such as diabetes. I am fortunate enough to be able to work with them and guide them in the right direction, beginning with their nutrition, as many of them struggle to find a nutrition plan that they can follow. Many people have come to follow diet plans such as a paleo diet, the Mediterranean diet, or even the ketogenic diet, to name a few examples. One question that I get quite often is, what can a diabetic patient benefit from following a ketogenic diet in specific? According to a study conducted by Abbasi in 2018, carbohydrates comprise of around 55% of the typical American diet, which ranges from 200 to 350 grams per day, depending on a person's overall caloric intake. Essentially, individuals with type 2 diabetes have impaired insulin secretion or are insulin resistant, and account for almost 90 to 95% of diabetic cases, according to Al-Khalafi et al. In a study conducted in 2009. It is important to remember that the ingested carbohydrates are absorbed mainly as glucose, which causes an immediate rise in blood glucose levels. Therefore, the management of blood glucose within the normal range is key when managing diabetes, as it may lead to several symptoms, including diastolic cardiac functions, cataracts, and neuropathy. In regards to the low carbohydrate ketogenic diet, it is described as a high fat, low protein, and low carbohydrate, and may be applied to treat intractable epilepsy, obesity, and obesity-associated illnesses, including diabetes. As mentioned, as carbohydrates are consumed, they may cause an immediate rise in blood glucose levels, so if the ketogenic diet is applied to their treatment, the carbohydrate intake would be restricted between 20 to 50 grams per day, hopefully primarily from non-starchy vegetables. The main point to consider is that the low carbohydrate content causing ketosis, which mimics a physiologic state of fasting, essentially results in decreasing glucose supply to the liver, muscles, and brain, resulting in a decline in the amount of glucose stored as glycogen. When the glycogen availability is limited in the body, it will activate a process called gluconeogenesis. This process and glycolysis, which is described as a breakdown of glucose, takes place simultaneously and are reciprocal. When the production of glucose by the process gluconeogenesis remains too low to cover the body's glucose needs of cells that primarily rely on glucose as fuel, ketone bodies will be produced as an alternative to glucose. This is described in a study conducted by Paoli et al. In a study conducted in 2013. In the condition that ketone bodies are produced, insulin levels in the blood will be low, which reduces the stimulus for fat and glucose storage. As mentioned, this state of fasting or a drastically reduced carbohydrate diet, the central nervous system needs an alternative energy source and thus is derived from the overproduction of the acetyl-CoA, which leads to the production of the so-called ketone bodies. This process is called ketosis and occurs primarily in the mitochondrial matrix in the liver, as described by Paoli in a study conducted in 2014. The deprivation of dietary sugars and starches on the very low carbohydrate diet, the body then reduces insulin secretion and has to switch to primarily burning fat within a week. In this metabolic state, or the state of ketosis, the liver converts fatty acids into ketone bodies that can penetrate the blood-brain barrier and provide fuel to the brain as well as the bodies of their tissues. Essentially, as insulin levels decline and the body switches to the fat-burning mode, it leads to further reduction in weight. Additionally, those following a ketogenic diet will feel less hungry, as they often naturally reduce their overall caloric intake, helping in promoting weight loss. While carbohydrate intake has been suggested to be restricted, the diet consists of long-chain saturated triglycerides in a 3-to-1 or 4-to-1 ratio. It is common to hear that a high-fat diet causes obesity. However, studies focusing on the ketogenic diet have suggested otherwise. According to the study by Abbasi conducted in 2018, individuals have lost hundreds of pounds on the ketogenic diet and have kept it off long-term by adopting the diet as their lifestyle. It has been shown to benefit those with an underlying metabolic phenotype characterized by relatively high in insulin secretion, therefore being used as a first-line therapy for obesity and type 2 diabetes. In conclusion, the ketogenic diet has had positive effects on body weight, waist measurement, and glycemic control. Additionally, many studies have shown to have individuals either reduce or get off their medications due to these results. Of course, through lifestyle modifications using low carbohydrate diet interventions, they're effective in improving obesity and type 2 diabetes as health professionals work towards reversing the current epidemic of this issue. Thank you.